All right, thank you, Tim. It's 10:45. A local cancer survivor is working to pay it forward by stressing the importance and need for funding children's hospitals. Now, Taylor Boehn just returned from Washington, where she participated in the 2019 Speak Now for Kids Family Advocacy Day. She joins us with her mother, Tracy, and from Connecticut Children's Medical Center, Jane Baird, to talk to us about her journey. First of all, let's start with you, Taylor. Congratulations. I mean, that must have been such an incredible journey. Tell us a little bit about it.
Yeah, it was definitely interesting going to Washington, D.C. and being able to advocate for something so important and getting to go to Capitol Hill and getting to meet everyone. It was definitely a unique experience.
And Mom, I have to imagine that was pretty emotional for you to be alongside her.
Yes.
Speak to us a little bit about what you went through just being there with her.
It was an emotional experience. When Taylor was 10, she was diagnosed with cancer, and she had multiple surgeries going through and chemotherapy at Connecticut Children's Medical Center. And it's a great place, and we're very proud of her and where she's come. And in Washington, it was just such a great honor to be able to advocate for child's health care because it's such an important issue.
And Jane, so you kind of see this from the patient perspective and you know, from the hospital side of things. Talk to us what it means to you to now see people really kind of putting forth the action to try and make changes going forward.
Sure. Well, we're members of the Children's Hospital Association, and they sponsor this event every year. And it's just, there's no better spokesperson and no better messenger to tell Congress why they need to prioritize children's access to health care. You know, you want kids to be able to grow, learn, and succeed. And Taylor faced a lot of challenges, but you can see she's now a successful young adult, and that's what it's all about. So nobody can bring that message better than a family that's been through it.
Absolutely. So inspiring to see you here, Taylor. And if you might have some folks who are watching at home, maybe a parent who has a child who's going through a similar thing, or a little kid who's watching who's going through it themselves, what would your piece of advice be to them?
I think just stay strong. I think that was like my biggest thing going through it all. Like as a kid, I feel like you don't really know what exactly is happening, and I think you just keep pushing forward because, you know, I'm 12 years after having it and I'm doing great. I'm like healthy, successful. So I think you just have to keep going and stay strong.
Keep that in perspective. And Mom, what would you want to see change differently going forward? What is your hope after having spoken with lawmakers?
Just that the funding continues to Connecticut Children's Medical Center, and that there is some thought into co-pays out of family pocket expenses that can be very helpful too.
Is there anything that you think needs to be changed from a perspective just being on the hospital side of things?
Well, I think that one of the things we talked to our congressional delegation about is just that we need to make sure that there's adequate funding so that any child, no matter what their source of health care coverage, can get the care that they need when they need it. So we're lucky we have a very supportive delegation in Connecticut, and they've always been really helpful supporting all of the priorities that we brought to them. So, but Taylor and her mom did such a great job telling their story, and that really brings it home.
Thank you. And Taylor, what do you see as the next steps? What's next for you?
So I recently graduated college.
Congratulations.
Thank you. With a degree in sociology, and I'm going to be going to grad school in the fall for elementary education. So I want to be a third grade teacher. So,
all right, so still working with children. Mm-hmm. You must be so proud.
I'm very proud.
Well, thank you, ladies, for being here this morning. Certainly an important cause.
Yes, thank
you. We
you
appreciate
for having
it.
us. Thank you.